Well, hello everyone, but we're back with another Q&A, and today we're definitely not going to bypass your medical doctor and give you all these solutions without you checking with them first because we don't want to make any claims that we can cure diseases. So, on that note, I'm going to just jump right in, answer a lot of questions. So, bring them on through social media and as well as our guests.
Absolutely. We got three of them stacked up. So let's go straight to social media. As you said, master and commander of the universe. Good for you. Didn't say which platform, but anyway, I've completely healed my fatty liver and blood issues thanks to all of your advice. I've shared my success on your website. Thank you, Dr. Berg. Anyway, that's a nice way to kick it off. Amandez from Rumble. Is it necessary for a 16-year-old to follow the keto diet while fasting for 20 hours per day without being overweight and being very active? Good for him or her.
So, when you're 20 years old, you have the absolute peak time in your entire existence that you have probably the best hormones, best collagen, best autonomic nervous system. And so when you're doing fasting for 20 hours, you're obviously going to create a lot of good because we know the repetitive eating creates insulin resistance. So you're going to avoid that whole mess. The key thing is because your metabolism probably is pretty fast at that age, you just want to make sure you have enough food and nutrition. So make sure it's quality and you have the quantity. You can do it and you should do it, but you don't want to start, at that age, cutting your nutrient dense foods because sometimes it's hard to get all your calories in one meal a day. So maybe if you're fasting 20 meals, you have two meals spaced out 4 hours uh, away from each other, and that way you can get enough calories to maintain your high level of metabolism.
What a disciplined young person. Okay, Ruthie from YouTube, what is your opinion about using black salt? Never heard of it. Is it better than Himalayan or sea salt?
So there's you have pink salt, you have purple salt, black salt. There's just different levels of minerals in there. There could be more charcoal or I don't know. I don't know what's creating the the black. Could be some nutrient in there. I have no idea, but I think they're all relatively great because we're trying to get all 94 trace minerals as well as other bigger minerals in there, magnesium and things like that, as well as salt. And if something is like a little bit redder, it could have a little more iron. So I would just test it out. And I do a lot of Himalayan sea salt because it's just no pollution in there, right? And then Celtic or Celtic sea salt is another good one. It's a little gray, but it's still great. I also do other types of rock salt, Redmond salt. I do Baja Gold. So I kind of switch it up. Baja Gold is a combination of the freshwater minerals coming off into this coastal gulf, and then it mixes with the seawater. So you have less sodium and chloride. So it's like 70% versus 98% or 95% sodium chloride. And so it opens the door for a lot more trace minerals. So it's a real different taste. This is what I give my cattle. I use it's called C90 for my cattle. I add the garlic in there. You can get that in bulk. But yeah, so that company is that's where you get the Baja Gold from C90. It's called. Um, that was a long answer to a simple question.
Well, so many choices, for goodness sakes. Let's go to Charlie from Facebook. What can I do to help with Achilles heel issues? Ouch.
Sometimes the Achilles tendon rupture occurs after taking an antibiotic. Did you take an antibiotic? But the Achilles tendon, if it's ruptured, obviously you have to get it repaired. But if it's just sore and it's inflamed, you could be overtraining. You could also be missing certain nutrients, including even collagen. You can't necessarily get enough collagen just from eating, chicken breast or even meat. You have to have other things like bone broth, um, and the skin on the chicken or the skin on the fish. Like 30% of all of our our protein is collagen. So you might need more of that, but you also might need the trace minerals or the vitamin C to help make that collagen. Another thing that actually stimulates the growth of collagen and making collagen strong is silica. And this is another uh, trace mineral that a lot of people don't get necessarily unless they're consuming certain foods. And so I actually like to take that as a supplement, and especially if you want to strengthen your bone and tendon, ligament, and collagen and cartilage. You can also get it as a silicone water. It also detoxifies aluminum because now they've been putting aluminum in the vaccines. So there's real interesting data on the relationship between autism, aluminum in the brain from vaccines, and then the remedy being the silica water, and even a supplement. You have to take it over a year, but there's great data on that, and you should know about it. So that's my long answer to another simple question.
Well, the audience likes long answers from you, doctor. And poor Yvonne from Facebook has tinnitus, and it's just constant. It won't go away. Is there anything we can do for Yvonne?
Well, tinnitus of what? Is it the elbow? Is it a joint?
Oh, isn't that the ear thing? Maybe I said it wrong.
Oh,
Tinnitus.
tinnitus. Okay.
Sorry. Yeah.
Tendinitis, but tinnitus, ringing in the ears. So I have 2 videos on that. Sometimes you have to take a lot of vitamin D to help mobilize the crystals, the calcium crystals in the ear. That usually helps. There's a couple other techniques. So they don't always work 100%. So I would try one, then try the other, and see if that doesn't help you with the tinnitus, because it could come from an old injury from, working in the music industry, standing in front of a huge speaker, or it could come from maybe you're in the military and you did large equipment that shot off missiles. There's so many things that can cause this. So I would watch my videos to get a detailed explanation of that.
All right, good luck, Yvonne. Okay, Against Big Pharma is the handle from Rumble. Will low levels of sucralose in my supplements knock me out of ketosis? That's a good question, I guess.
Yeah, it will. Yeah, but of course, when you say low levels, of course, when you bring it really low, it's going to knock you out just a little bit. But when you're talking about ketosis, we always talk about bringing your carbohydrates, and that's kind of a general term because carbohydrates do include fiber, which we don't have that as part of the equation. It also has sugar, and then it has starch, right? So, and then that opens up a can of door for a lot of different types of sugars, industrial sugars, synthetic sugars, high fructose corn syrup, sugar, fructose. So that's a whole other seminar for that. And then you have the starches, which aren't sweet, but it's a chain of sugars. So it's kind of picture, this is here, these are individual glucose molecules. If you connect them, they form a starch, okay? And so when you're consuming an industrial starch, like this powder maltodextrin right here, it behaves like sugar, even though it's not classified as a sugar, but it even can spike the blood sugar higher than actual sugar. And so because it's been processed, and it's not sweet. But if you take a piece of bread in your mouth and you chew it for 30 seconds, you're going to release an enzyme called amylase. It's going to break down that chain of glucose molecules of the starch, right? And then all of a sudden, after 30 seconds, it'll become sweet because you're finally turning it into opening up the chains to get glucose in your mouth. So the point is that the more industrial refined the starch or the sugar is, the worse it's going to bump you out of ketosis versus consuming fruit, which has all the fiber and the phytonutrients that will have much less effect.
All right, sounds great. And Urban Viscous, if I said that right, Terry from Rumble. Why does the bottom of my face have looks sort of rough and has small bumps, and my cheeks are quite red? Any ideas?
Well, it could be the beard that you just grew, but here's the thing with the red face. That's rosacea, which is purely a gut problem, an imbalance with the microbiome. A lot of people are finding that it'll disappear if you make your own probiotic. It's called L-Reuteri. You should look up my video on that and watch that and do that. And that just might get rid of those little red bumps, acne, and especially that redness, rosacea on your face. It's like a classic indicator of you probably had one too many antibiotics.
All right, very good. Let's go to our first exciting question for the day. And there it is, doctor.
Okay, out of all the nutrients, which one has the greatest impact on building muscle?
All right, audience, your usual brilliance in that regard. And let's now go back to social media with Kaufman 10. What are the best natural binders for heavy metals that you would use?
Well, if we're talking about aluminum, I would use silica. There are a series of things you can drink as a shake or a juice, parsley juice, and there's several others that are natural chelators that chelate these heavy metals out of the body. I probably should do a video on that. There's also, I think it's called EDT. Was it EDTA? I can't remember the exact acronym, but it's a chemical that helps bind and chelate heavy metals out of your body. And that's one thing you can do as well. When you consume water that's distilled, you can help pull out metals and minerals out of the body as well. The problem is you better put back in the ones that you want. But I will say heavy metals are a big problem for a lot of people, including children, especially as you get into autism. And you need to start looking at that and making sure that the environment doesn't, keep contributing to heavy metals. So yeah, it's definitely a situation. There's ways to pull out these things, but I should do a video on that, and I will.
All right, very good. Why don't we go to our first guest coming to us all the way from London, and it's Joy, actually coming from the city of London, I believe. And let me put your audio on. And Joy, one question in 30 seconds, if you don't mind. Go ahead. Your audio's off, dear.
Start again. Good afternoon, Dr. Berg. I have a quick question.
Hi.
My 15-year-old has... Can you hear me?
Yep.
Oh, so I have a 15-year-old who has myasthenia gravis, came on suddenly at the age of 11. She's had thymectomy, rituximab, everything. Had that about 6-7 months ago. Still has the droopy eye, doesn't like to eat properly. What can I suggest to help her fatigue and just to have a greater quality of life? I hope I hit the
Yeah.
30 seconds.
Here's what's interesting about London, out of all the different places people live, that's the city that the majority, I mean, out of all the different cities in the world that watch my videos, London is the number one. So go figure. But what I would recommend for your child to take is a supplement that involves a thymus supplement. Okay, you can get like a sheep extract from thymus, and then take one of those before bed. And I would also have your child take at least 20 to 30,000 IUs of vitamin D3 every single day, which will strengthen the immune system. There is some interesting data on, let me see, what is the website? It's called Hormones Matter. You should look up hormonesmatter.com and then look up that condition, and you might find some additional interesting solutions.
All right. Well, listen, thank you for a good call, and I hope that helps your daughter a great deal, if I heard that right. Anyway, let's go back to social media. And by the way, stick with us, Joy, and all the rest of you. You can answer all the questions and all the exciting stuff. Anyway, back to Cowgirl Aselli from YouTube. Which kind of magnesium would be best for a 4-year-old, and what would be the recommended dosage?
I would probably do maybe 100 milligrams, which is probably 1/4 of a scoop. It's probably easy if you do it in a powder, but I would get magnesium glycinate because that's the one that doesn't create the diarrhea, and that's the one that gets the best absorption, 80%, versus the magnesium oxide, which is only like 3 to 4% and creates a lot of diarrhea. So yeah, glycinate, and then that'll be good too to give the child in the evening, so that way they'll have a better sleep. I take a lot more magnesium now than I did before, and it definitely makes a huge change, not just with muscle tightness, spasm, Charlie horses, and sleep, but to also improve your muscle performance when you exercise. Also to improve your energy, because magnesium is key to make ATP. That's basically your energy in your body. So don't forget about the magnesium. And it's very difficult to test it, but I would just operate on the assumption that you probably are deficient, because most people are.
All right, very good. Well, you bragged about the UK, which is joining us today. And here's the rest of the world: Canada, Mexico, Guatemala, Armenia, Jordan, Tanzania, the Canary Islands, Iran, Belarus, Chile, Ghana, the Philippines, Greece, Pakistan, the Virgin Islands, Nepal, Belgium, the Czech Republic, Sierra Leone, Ireland, Egypt, Finland, Australia, Oman, India, South Africa, Algeria, France, Saudi Arabia, Peru, Austria, Poland, Scotland, Lithuania, Eritrea, Turkey, Israel, Romania, Bermuda, Switzerland, Albania, Denmark, Qatar, or Qatar, however you like to say it, Ukraine, the Netherlands, Indonesia, Brunei, Thailand, American Samoa, New Zealand, Switzerland, Ethiopia, Panama, Malta, I haven't heard from them, I don't think, ever, and all across these United States. So thanks, everybody, for joining the show and making it such a great success as we all celebrate health together around the world. All right, let's go to another question. Finite Mathematics, good for you, from YouTube. I'm worried about my girlfriend's mom. She has gastroparesis. Thanks for that spell out, Terry. I needed it. And it's leading to a laundry list of other conditions. Your advice would be greatly appreciated.
So this is a condition where the autonomic nervous system is affected, and the digestion, the food going through that the stomach and other parts of the digestion is slowed down. So that's what this is. That's one of the side effects from Ozempic, just FYI. That's why I don't recommend it. The other thing it could be is a severe vitamin B deficiency because you have diabetes, or you're just very deficient because you consume a lot of refined carbs. So start limiting the carbs, and then we take a lot of B1, natural B1, with probably benfotiamine, which is an additional help with, it's a synthetic version of B1, but you need B1 to support the autonomic nervous system to repair that, because out of all the autonomic nervous system problems, both sympathetic and parasympathetic, B1 is probably one of the best things to give to the person to help restore that system, so we can get a normalization of digestion.
All right, terrific. I was fiddling with my controls. Let me get back to social media. Oh, how about our quiz question number 1, which an answer came through. And it asked of the audience, of all the nutrients, and this is interesting, which one has the greatest impact on building muscle? We certainly want to know that. 75% of our respondents say it's proteins like red meat. 20% say it's fatty fish with omega-3s, and 5% say it's foods rich in amino acids. Any geniuses out there today, Doctor?
I think everyone is right, but I was looking for more of I should have refined the question to what mineral, because it's zinc. But you are correct. You do need amino acids to build muscle, or else it's not going to happen. But the cofactor, the helper mineral involved in that, is zinc. And why would zinc work for muscle? Because it's a very potent way of stimulating testosterone. Even if you're mildly deficient in zinc, your testosterone can go down by 50% in men. So testosterone helps. Zinc helps increase testosterone, which helps build muscle. And think about this, right? Testosterone is a hormone that is made from something called cholesterol. So those people that are taking statins are literally eliminating the raw material to build testosterone. So I don't care how much zinc they take, it's not going to work unless they, deal with their cholesterol another way other than taking a statin, which basically shuts down your muscles. I mean, the big symptom of statins is destruction of muscle tissue and ATP energy. So, and also coenzyme Q10. So that gives you energy, and it helps with the mitochondria. So this is why, like, when you're trying to solve a problem, you assume that your high cholesterol is coming from, it might end up with a heart problem, so you go on a statin. Well, is that the best solution for that? Maybe you want to try something that doesn't have side effects like destruction of your muscles in many different ways, not to mention depleting coenzyme 210, which puts more stress on the heart. So anyway, there's just, I want to give you guys practical things that you should do, but I also want to get you in a situation where you're relying more on food, good food, nutrition versus drugs to solve health problems.
Well, you've been ahead of that curve for a long time. Now the rest of the world seems to be catching up, and I hope that's true. Here's quiz question number 2 for the day.
Out of all high omega-3 fat, foods, which one has the most anti-inflammatory effect on your joints?
Okay, audience, I know you've got an answer for that, and I know that the audience has tons of, hang on, I fumbled, but now I'm back. Sharon from Facebook, my husband's PSA count is at 12. I think that's high. What can he do naturally to lower that count?
There's some data that shows that you should avoid, you need to lower your testosterone, and or high testosterone will create a problem with the prostate or PSA. I would really watch my videos on the prostate, because zinc, avoiding plastics, avoiding chemicals in the environment like endocrine disruptors in the water, all can help bring that down. The other thing, there's some great data that shows that when you're severely low in testosterone, that can increase your risk for prostate cancer. Now you're like, what? Wait a second. I thought that caused it. No. And I'm not talking about injections of testosterone. It's like some people do the pellets to actually increase the testosterone. It decreases the risk of prostate cancer. This is completely the opposite of what people have probably been told, but there's some fascinating new information on this that will make a lot of sense, because if you think about it, as a male gets older, right, they have more risk for prostate enlargement and prostate cancer. But what's going on? They also have a severe tanking of the testosterone. So why the correlation between, you need to, it's testosterone? No, it's not. It's probably the lack of testosterone, because testosterone is involved in things that go way, way beyond erectile dysfunction and many other things. So anyway, watch my videos on that, and then that should answer it.
All right, very good. Let's go to Elba from Facebook. After eating beets, BEETS, is it normal to see red in our waste products for days afterwards?
Yeah, it is normal. And it's just a pigment that's not broken down. I wouldn't worry about it.
Thank goodness. I bet they've been sweating that, as I would with my hypochondria. Tam from YouTube, what driver's license photo looks like one of those got milk ads? Is there anything I can do for paleness in the area of the nose and upper lip? That's interesting. Is that alopecia or?
Well, I think, when you're dealing with paleness, I'm thinking anemia, which people think, I need to take more iron. Well, be careful about doing that, because usually you can have anemia even with too much iron, because when people have that problem, which is actually, I think it's more common, it's actually iron dysfunction. So you have too much that's stuck in the tissues that's creating a lot of rusting of organs, yet it's unavailable to the blood cell, many times because you're lacking copper. So you should watch my recent video on iron, because I cover that paradox that I think you'll find quite interesting. But again, if you came in my office and you had these symptom of being pale, the first question I would say is, what are you eating? What are you not eating? And then list that and change your diet, because you might not be consuming enough red meat, things like that. So I would make those changes first, because when you go to Wikipedia, for example, and you try to diagnose yourself, it'll tell you all the rare things mixed in with the most common things. They don't tell you what's the most likely thing at all. In fact, they'll probably take that and bury it. I mean, just take a look at, if you just type Wikipedia and look at diabetes, look at the cause of diabetes. They do say it in there, but it's buried as a side note, high carbohydrates, sugar, things like that. Like that should be in the top part, but they don't list that. So they kind of hide it. And so it makes it obscure, hard to find the real problem.
How frustrating. Okay, and the audience was not frustrated with quiz question number 2, which asked, of all the high omega-3 foods, which one has the most anti-inflammatory effect on your joints? And 78% this time responded and say it's fatty fish like cod liver, salmon, and sardines. 12% say olive oil, yum. And 10% say it's turmeric or krill oil. Boy, those are out, on the periphery.
So you're all right, but I want to just clarify something, because when we talk about omega-3, we're actually talking about 2 different fatty acids. We're talking about DHA and EPA. DHA is mainly for structurally supplying your brain tissue, membranes, and the eye, the retina. But when we get into EPA, that's when we get into the anti-inflammatory type things, not the DHA, but the EPA. And so that's an anti-inflammatory, anticoagulant. It just helps thin the blood. Very different. Also, it affects mood, decreases stress and cortisol. So now the question is, what has the most EPA? And yes, fatty fish has that. But within the fatty fish category, we get down to cod liver oil and cod liver, which someone said. So that's, if we compare that to regular fish, because we're dealing with fish oil versus a liver oil, right, in a fish, we get a lot better amounts on EPA, more anti-inflammatory. Plus, we get 2 additional things that can take us to the next level that are not in fish. It's the cod liver oil has vitamin A and vitamin D3. Both have potent anti-inflammatory effects. So, but the other things that people mentioned don't have those 2 additional things. So if we wanted to, take it to the next level, I would recommend cod liver or cod liver oil to have the most anti-inflammatory effect compared to anything. And like you can even do cod liver a couple times a week as your protein meal. It's actually quite delicious, and it's in a can, wild cut cod liver, or just take the supplement cod liver oil, and that can help you.
Terrific. By the way, Nare, can you hear us? I just nod your head. Oh, very good. Well, okay, good. We've got a wonderful lady from Omaha, Nebraska, and she's got one question which we'll get out in 30 seconds. Go.
Hi, Dr. Berg. I really appreciate your work. My question is about keto and intermittent fasting for people with thyroid issues. Do you recommend healthy keto and intermittent fasting for someone who has hyperthyroidism and Graves' disease?
1,000% yes, because that probably could have helped to prevent it. We're dealing with an autoimmune, and by the way, most thyroid conditions, whether it's a Hashimoto's, which is a low thyroid, or Graves, which is a high thyroid, they're both autoimmune. They're more of an immune problem that could be set off by various things that can affect the immune system. I would there's a couple distinctions between that, but let's just focus on what I think you should be doing. You should watch my recent video, Dr. Coimbra interview on vitamin D, but I didn't title it as that. It was like vitamin D toxicity. And I talked to Dr. Coimbra. He has a Coimbra protocol from Brazil. He has 4 doctors in the US that you can consult, and a lot of other doctors out of the US that you can consult to use high doses of vitamin D3 to really address your immune system and put that thing back in remission. Also, vitamin B1 is important in the hyperthyroidism. And then the other thing is not to take iodine, because we don't want to speed up the thyroid. It's already too fast. The other thing you want to be careful of not taking any purified bile salts, because that also increases the conversion from T3 to T4, and that can make things worse. So that's one time where you don't want to take bile salts or iodine. So, but that's what I would do.
Okay. I'm taking one of your supplements as well, the zinc, magnesium, and selenium. Is that good as well?
That's right. Yes, you need selenium. That's really smart. Yep, that's right. Because guess what selenium does? It supports the immune system, especially in the thyroid. So yeah, that's the one that I think can help you. But just make sure, double check on it. I don't think it has iodine in it, so make sure it doesn't have iodine.
Okay, will do.
That's great. Well,
Okay.
we are all rooting for you to feel better, Ray, and thanks for your great call today. And good luck with all your health issues and so on. All right, let's go back to social media. No, let's not. Let's go to quiz question number 3. How about that? And Doc, this is misbehaving. Oh, there we go. And there it is, Doc.
Okay. Why do 40% of heart attacks occur between 6 a.m. in the morning and late morning?
That's scary. Okay, folks, listen up. Yojo Mojo from YouTube, please share your advice on eradicating and preventing varicose veins. Thank you.
Obviously, they mostly occur in the lower legs, and the worst thing about these veins is the sedentary lifestyle. So maintaining high level of exercise consistency when you get older will help reduce and prevent them. But again, we're dealing with the vascular system, and there's a recent video that I talked about relating to that, talking about getting more infrared in the body and drinking more structured water, which is a kind of a like, what's that? Well, you can literally take your water and put it out in the sun for a couple hours and then drink it, and it's structured water that can actually help your blood flow and circulation. It's great for the heart. There's some new data on that that relates to the heart not really being the primary thing that is pushing all your blood through the circulation. See, what happens is you have this so-called heart that's supposed to be just a pump, but it's not just a pump. And then you also get help with in the vascular system through how the water is structured and how it moves. And then we have all this blood that goes through the arterial system that's carrying oxygen down into the capillaries. And then it crosses the capillaries, and then it goes into the venous system back up through and goes through the lungs to get oxygenation, and then to the heart again, right? So the venous part of that, if it's stagnant, if it's sluggish, if it's pooling because of the lack of that circulation, then you get these varicosities or even spider veins. But that's mainly it's a different thing. But I think an active lifestyle, including a lot of exercise, especially if you're lower extremity. And I also did a video on exercises for varicose veins, and also doing that with your feet elevated can be a very powerful thing to help you.
Wonderful. Why don't we go to our final guest of the day? So, Shauna, get yourself all set for your one question, 30 seconds. So far, our attendees have done a great job, and I know you'll be no different. So, go ahead with your question. We can't wait to hear it.
Thank you. I love fruit. I've been told my whole life the fruit is good for me. I'm trying to figure out where that fits in the keto picture, how much and the quantity, or quantity
Good,
and when.
good question. People will tell you, well, fruit's natural. There's a lot of vitamins and minerals. Yes, it does. Our bodies were developed to not necessarily consume excessive amount of hybrids of fruit all year around, because they have bred fruit to become extremely sweet. But way back in the time, we just had it seasonal, and a lot of the fruit wasn't quite as sweet as it is now. So we're just getting a lot of excess sugar. Now, if you have a good metabolic system and you haven't abused your metabolism like I have, then you probably can get away with more fruit. And some people can deal with this extra sugar because their mitochondria is really strong and healthy, and they don't seem to convert it. But personally, myself, if I had too much fruit, I would start gaining weight pretty fast. And one time I needed stem cell, and I needed to gain gain more weight. And so how did I do it? I just ate a lot of apples, right? So if you consume fruit in a smaller amount and maybe berries, which have the lower amount of sugar, um, that's probably going to be a lot better. And if you can keep those carbs below 50 grams per day, then you can actually continue your ketosis. Now, here's the thing though. I think if you can build up a level of health reserve over a period of time where you have the flexibility to eat more fruit, then that's fine. But some people, don't have that. They don't have that reserve yet. So for those people, I don't recommend it because it's just slowing you down because it is sweet. And then you can always just test the water and see how you do and see if you feel better and if you're gaining weight and check your biomarkers to see if you can tolerate certain amounts of fruit. Some people can tolerate more than others. Younger people can tolerate more, but it all depends on kind of where you're at. So I guess that's a real broad spectrum answer. I'm sorry I didn't give you the black and white on that.
Thank you.
That's great.
You're
Thanks so
welcome.
much. Some
Kinda like-
great.
It just the answer is it depends.
Yeah. Well, by the way, Dr. Berg did not include, when he had that test, he called me and he said, Steve, I need to get fat and bloated. Can you help me with some counsel? And I did lend him the necessary advice to do that. We got through that very quickly. All right, let's go back to social media. I don't think I asked this. Celia from YouTube, what advice can you share about staying on healthy keto path consistently? So what kind of discipline do you need to do that?
I haven't revealed this yet, but there's a great DNA test that I'm really liking. And I'm working with that company to kind of create some videos so it can be like do it yourself, so you don't even need anyone to interpret it. But I'm gonna do a video on that. But in that series of DNA testing, you can look at your DNA for your genes that relate to all sorts of weaknesses that you might have. And so what some people like myself have learned from that test is that if I go off my program even too much, I'm going to have a lot of problems with inflammation. I'm going to have a lot of problems with, cholesterol, heart issues, because of my genetics are not be able to deal with that too well. So that actually is pretty motivating because it tells me that even though I have those genes, I can control it if I stay very strict with my program. So I have a lot of inflammatory genes, and it doesn't bother me until if I overtrain, it does. If I go off my program, it does. So that keeps me very, very strict. But I think for me anyway, it took me many, many years to get really strict and stick with the program. And I had to go off and on and off and on just because I had a hard time giving it up. But now I can have a lot more control because it's almost like a muscle. It's like you have to kind of like say no enough to kind of like strengthen your willpower to the point where I can just go, no, you can go ahead and eat it in front of me. It doesn't bother me. But some people can't do that. But I had to kind of get beaten up for years physically before I said, that's it. I don't like the way that makes me feel. I'm not going to spend 2 days feeling bloated anymore. So, and then as you get older, it becomes more important. So I think it's just a matter of going through the process and working on observing for sure, like, wow, yeah, this food makes me feel like crap. This food makes me feel good. I'm going to, from my own accord, so no one's forcing me, I'm going to do it for me. So that's what I would recommend.
Yeah, my mantra is nothing tastes as good as not having depression feels. And that, say it once,
that's
and it's
true.
I mean, it is. I feel so great after your counsel. Let's see, Silja from Facebook, any good advice for treating the horrible tennis elbow?
Here's what it relates to. I think really a lot of times, believe it or not, it relates to food. You might be doing too much omega-6 seed oils. So if you eliminate all those and really look at that, you might find that that just goes away. And I'm talking also about omega-6 fatty acids in food too, like grains. But there's other things. There's other plant chemicals that create inflammation too, like lectins, and that would be like in peanuts and nuts and seeds and grains as well. That could be causing it, and even oxalates that in spinach, chocolate, almonds. So you might want to look at that and then clean up any sugars that you have. And if you still have it, then watch my video on tennis elbow, because there's a technique to work on the opposite side of your elbow to get rid of that elbow pain.
Terrific. Let's go to quiz question number 4, which asks, why do 40% of heart attacks occur in the morning between 6 a.m. and late morning? And there you go, Dr. Berg. Our respondents, 65% of them say because of elevated cortisol levels, 25% say it's because of dehydration, and 10% say it's because of low levels of potassium and magnesium. They all sound very scientific. Any winners for this question?
See, everyone is correct, because if you're dehydrated, you're going to have a less sodium. Sodium does indirectly increase, or a lack of sodium can increase cortisol. So we got that. That's correct. And then cortisol is correct too, because you have it right in the center. And then if you have low magnesium, even potassium, it's going to affect you more in the morning because of the circadian rhythms. But the answer I guess I was looking for would be more cortisol, because most heart attacks, 80 to 90% of all heart attacks involve clotting, like you just clot. So several things can increase clotting, and one is stress, cortisol and adrenaline. This is why even people that have a severe stress of a loss of a loved one, is called broken heart syndrome, their chance of getting a heart attack goes up by like over 2,000%. So one of the things that you can do is to add more magnesium, which lowers cortisol, have more sodium at night from salt, lowering more cortisol to decrease your risk of having this heart attack. But there's a lot more to this. I'm going to do a video on it, but the point is that we're always focused on food, but the stress can also be another factor that can mess you up.
All right, very good. Let's go to quiz question number 4, and there it is.
True or false? The primary issue with overtraining is a lack of muscle development. Because when you're overtraining, right, you're not going to be able to keep growing your muscles, right? Is that the main problem with overtraining? True or false?
Okay, Parip from YouTube, could you recommend anything that would slow down my father's inclusion body myositis? Excuse me. Thank you, Terry, for that. Progressive muscle disorder characterized by muscle inflammation, weakness, and atrophy, and so on. My father has had it for a decade, and now it's progressing day by day. Is that a condition you've heard of?
So the first thing I would want to find out is, what are you eating and what medications are you on? Are you on a statin? And I'm like, oh, bingo. That could be why you have it right there. Or you're consuming things that create inflammation. The omega-3 fatty acids can drop inflammation in the muscle very rapidly. Steve, I recently had surgery on my big toe because I got a joint replacement, because 4 years ago, I was bringing my horse up to the barn and in sandals. And I don't know if you ever had a horse step on your toe, but it's slightly painful. 20 years previous, I dropped a 45-pound weight on that same toe. So anyway, I'm like, what is going on with my toe, right? So then I find there's filled with arthritis. So got the toe joint replaced. And so now I have to wait a month. I'm in a boot. So this means that I had to severely shut down my activity. And I mean, going from like crazy running up hills to now like laying around waiting for this thing to heal. What was interesting to me is that I'm noticing I'm actually finally have a chance to recover. And I thought I was recovered. Now I'm like really recovering. And it's amazing how I just feel a super strong, like in my muscles now. I'm like, where do they come from? It's from the recovery. I'm really, getting the full recovery. So I think one confusion or realization I just had is I need way more recovery than the average person because my inflammation joints are high. So what I should be doing is probably one hardcore workout a week right now and then walking in between. And I'm going to be trying that once I recover. But the point is that you might have inflammation in your muscle because you're overtraining, and you might not even think you're overtraining. So get your
Wow.
joint and then see if you don't then get rid of your myositis.
Oh, that's terrible. What a bad horsey. All right, let's go to back to social media. And we did ask quiz question for, so let's stick with social media. Celia from YouTube, what is your advice you'd share about, oh no, we already did that, excuse me. Barry 2 from Rumble. How can we solve blockage in the gallbladder and the bile duct?
You get this sludge from a lack of bile salts. So you want to increase the bile salts. When you don't have the bile salts, then you get this super concentrated cholesterol sludge that then will turn into stones. So if there's any obstruction in those little tubes from the liver to the gallbladder, you need to take TUDCA. Empty stomach, take 2 twice a day until you feel better, and then take it once a day. That just opens up the dam. There's no more blockage, and it just will give you so much relief. And listen, I had that problem for literally close to 18 years. And I did not know it was the bile duct sludge thing. I never took a bile salt. And then when I started taking, I'm like, all that fullness and tightness went away underneath my right rib cage. I'm like, you mean to tell me I had that problem? And so a lot of people have it. They don't know what it is, but TUDCA is such an amazing remedy. If you can't figure out what your problem is, just take some TUDCA and see if it doesn't go away, because it does a lot more than that.
Wonderful. All right, Barry 2 from YouTube. Which supplements would help with social anxiety? I'm sorry you're feeling that, experiencing that, Barry.
Ashwagandha natural vitamin B1. I would really beef up on the natural B1 too. Just take a good amount of that, maybe 4 times whatever recommended. And so you'll start feeling like, oh, wow, I feel calm, or I could deal with stress. But then in addition to that, make your own probiotic using the L. reuteri microbe. And that it seems to improve empathy and social, like you're going to become very, very social without the anxiety as well, because it drops cortisol. It increases something called oxytocin. And a lot of people are taking that now. And they're noticing like a huge shift in empathy, which is wild that a microbe can actually do that. But that microbe is very susceptible to antibiotics. So if you've ever had an antibiotic, chances are you probably don't have that anymore. And guess where that came from? Breast milk. So if you've never been breastfed, then that could be the reason why you're also deficient. So thus the importance of not going down the road of infant formulas, which can create deficiencies later in life.
All right, very good. Let's go to quiz question number 4 for an answer. And the quiz question is a true-falser. The primary issue with overtraining is a lack of muscle development. And the audience, 95% of our respondents say it's true, and 5% are holding out for false.
So we typically think that if we overtrain, we're gonna get a little sore, more soreness. We're not going to develop the muscle as well. That's just such a tiny effect of overtraining. The real big problems of overtraining is a lack of quality sleep, alteration in your hormone cortisol going to go up. Your appetite, you're going to crave the wrong foods. It can affect your cognitive function. It can create more anxiety. It can just make you tired all the time. Like there's a lot of other things that overtraining will do. It'll keep you inflamed, increase inflammation, which causes more insulin resistance problems. So there's a lot of problems with overtraining, and the importance of not to overtrain and let yourself self-heal is like way more important than I thought before. And I'm a perfect example of it.
Wow. Okay. Celia from YouTube, any recommendations for naturally resolving a fungal toenail? A lot of that going around. Are prescription meds the only way to heal it?
Tea tree oil or iodine topically on the nail. Now, I would also beef up your vitamin D, and some people even use topical vitamin D, and that works. But I would use probably iodine or tea tree oil. You can try oregano oil. These are all things that can help reduce funguses, yeast, mold, mildew, bacteria, and make that microbe go bye-bye. Because it lives on the protein in your nail, and it's like eating that nail. So we want to kill that thing. And but the question is, why did you get in the first place? Well, probably because you're low vitamin D, your immune system was susceptible, and you were weakened, and you have to beef that up. I think we don't have enough importance about strengthening our own immune system. We rely on external things that we think are strengthening it, like vaccines, which I think are not the best way to strengthen your immune system. But that's just my opinion, and what do I know?
Okay, let's go with quiz question number 5, and there you have it.
Okay, why is aspirin not recommended for everyone over the age of 60 anymore?
Boy, that's a big change. Okay, Micah from YouTube, are you familiar with amogtine as an experimental drug? Amogtine, Terry, is that, let's see, amogtine, it's been studied or something? Anyway, is that a dumb question?
Well, because of all my extensive experience in pharmacology and drugs, no, I don't have a clue what you're
All right,
talking
good.
about.
Well,
Sorry.
we'll get back to that at some other time. Now, let's go to Lady LF from YouTube. Is there something that can help with cervical stenosis due to severe trauma from years ago? The nerves get pinched too easily. What are your recommendations?
So if you have, that's basically the spinal, the canal is a little too small, and it could be because we're getting some buildup of scar tissue or even calcium inside that canal, and that could be a problem in your neck, right? So, and that can create pain on the arms and things like that. I have a lot of injury in my neck too. There's a great, I don't know if I have it in here, massage tool, and that you can get on my website that fits really nicely into your neck and it keeps that curve nice and it keeps the curve in your neck very nicely. So I do this every night before I go to bed, and I lay it on the back of the couch, and it just melts the muscles on there, because as you get stenosis, you lose the curve in the neck, and it creates a lot of problems. You have to also realize that you could just need to reduce the inflammation in your body to give you just a little more space in there to keep you symptom free, in which case really work on your diet. Do fasting, do prolonged fasting, do periodic prolonged fasting, take vitamin D, and see in high doses to see if that can reduce the inflammation and the stenosis, because I would do everything I could before surgery, because it can, I know over time your neck becomes more arthritic. And this could come from an old whiplash or whatever, a compression injury. One of my videos, even if you don't get my massage tool, I show you how to do it, but you need someone else to do this with pressure points in the back of the neck. Very gentle, sustained light pressure, works like a charm. I think it would be in the video called what was it called? What is it called? It's called the stress seminar. I think it's called the stress seminar, but you might have to just find my videos on that. And I actually show you how to do it. So you have a friend or family member do this technique on you, and it'll give you some really nice relief very quick. And who knows, you might not need to do an invasive type therapy.
Okay, let's go to Lynn from YouTube, who has lately contracted gout in her right thumb. I rarely eat red meats, and my diet has been pretty consistent with kale smoothies, legumes, chicken, and my primary foods as my primary food sources. What could be causing the gout in her thumb?
Well, you should also look. It might be oxalates as well, because you have the kale. So you might want to eliminate some of that and see if it doesn't go away. Also, if there's anything with fructose. Also, chicken is high in omega-6, which increases inflammation. So we want to probably do grass-fed, grass-finished beef, and that might just help you. Before you're fully convinced that it's gout, check these other things, because it might be pseudo-gout, and also just to decrease your uric acid. One thing that people do is drink celery juice in the morning. That seems to help. But then watch my videos on pseudo-gout and gout and what I recommend with the diet, and you'll get a lot more details.
All right, that's terrific. We have left room to answer quiz question number 5, which asks, why is aspirin not recommended for everyone over the age of 60? Boy, so many things change. The audience, 92% say it increases bleeding risk for those over 60, and 8% says it can create stomach issues. Sound like good answers.
There's no doubt that aspirin, by the way, has been used for over 4,000 years in the form of willow bark for pain and fever. But aspirin has helped a lot of people prevent the clotting. Remember I said the clotting is the most common reason why people get heart attacks and stroke? So that has been used for many, many years. But to have everyone take it over the age of 60, now you're not looking at the benefit to the risk ratios, right? The ratio of that is not good, because the risk of bleeding in your stomach or your GI lower down or your brain is a side effect. So if you don't really have a problem, then you don't want to take it. There are natural ways to thin the blood, and one is the omega-3 from the cod liver oil, because the way aspirin works is it blocks the enzyme that makes the platelets. So you have the platelets that respond to stress, right? And it's like a glue that comes in there. So aspirin blocks the enzyme that makes the glue, the super glue. Well, omega-3 fatty acids in cod liver oil replace the material that makes the super glue, turning it into more like a jello. So it doesn't stick as much. It's sticky, but it's not going to stick really hard. So you don't get the clotting formation as much. So I think a much better natural solution is just to beef up your omega-3 fatty acids from cod liver oil or actual cod liver, and that might help you.
Okay, Halu has been hanging out patiently on Rumble. Let's see if we can get her question asked and answered. How do I lower my TSH thyroid levels? My thyroid gland was removed years ago.
Well, your thyroid hormone, stimulating hormone, is trying to connect with something that's not there, so it's going to go up, and so you're probably going to have to get with your doctor to actually, if you don't have a thyroid, you're going to have to take a thyroid hormone. I would recommend Armour, but I'm not your doctor. But that's kind of a natural form of the thyroid hormones, because you get not only T4, you get T3 and some other things. And then they have to make the adjustments to increase that. So then now the pituitary that makes thyroid stimulating hormones not like, hello, are you there? Will you please answer me? And then so now we can get that feedback to turn off that higher level. So you're going to have to just make adjustments to your thyroid hormone.
All right, very good. Well, any last words, Doc?
I just want to say that I'm releasing quite a few new videos every day that are not long form. They're short. So watch my short videos. I'm doing 4 long form videos and 3 shorts right now. And so So if you don't see me on the feed, just click on the shorts and you can check those out. And on that note, have a wonderful weekend. I will see you next week, same time, same place.